Mr. Speaker, that answer is not satisfactory. Mr. Speaker, we would like to know, because we approved the budget.
Order, Honorable Moniki.
Yeah.
Are you not a member of the Committee on Health?
No. I'm not a member of that committee, Mr. Speaker.
Oh, is it?
Mr. Speaker, when the ECM says that there was a delay in approval of cabinet paper, Mr. Speaker, one will wonder, because we know who is the cabinet. We know the members of the cabinet. Mr. Speaker, we approved the budget, and we need to be told why was the delay in approving the cabinet paper, so that patients can miss drugs, Mr. Speaker. Mr. Speaker, that's a mockery. For an ECM to tell this assembly there was delay in approval of cabinet paper. Money was there. The cabinet paper was prepared. How can we delay approving a cabinet paper for the purchase of drugs, Mr. Speaker? That is something that we need to be, it has to be explained properly, Mr. Speaker. On question number 2, the member for Elima wants to know the purchasing plan for the drugs. And in that, he wants to know whether there will be also a delay in approving of the cabinet paper, because there must be a cabinet paper to be approved before there is the purchase. Are we going to experience the same? And on top of that, we are asked by members of the public, when they miss drugs in the hospitals, what is wrong, what is happening, when do we expect to see these things? Mr. Speaker, we represent these people. And sometimes you find that we don't have answers. Like, you cannot tell a patient, the governor delayed in signing approval of the purchase of drugs, yet we approve the budget. We need to know when we expect the next batch of drugs. Probably, if it is quarterly, before the end of the quarter, we need to have the drugs ready, Mr. Speaker. Because we have had this problem, not this time, many times. Delays in the purchase of medicine, Mr. Speaker. The other thing, Mr. Speaker, we'd like to see, I request the COG, County Council of Governors, to implore the national government, because county governments purchase drugs from the central medical stores, KEMSA, and the medical supplies meds, Mr. Speaker. So that, because we approve budget for the drugs and we know the much that we expect from the national government, and much of the money is deducted for the headquarters, they should consult and discuss with the national government so that we don't miss drugs in the counties, because this institution belongs to the government. KEMSA is a parastatal. Then it's also parastatal also. So I don't see the reason why county hospitals in Kenya should be missing drugs. Thank you, Mr. Speaker.
Honorable Chair, member for Elima has raised a pertinent issue. I want to refer you to the provisions of Section 39 of the County Governments Act, accountability of county executive committee members. That members of the county executive committee members are individually and collectively accountable to the governor in exercise of their powers and performance of their duties and responsibilities. 2, when that doesn't happen, or there is an issue on that accountability, then Section 39(2) provides for the county assembly to require an executive committee member to appear before assembly committee or provide information to the county assembly on matters related to their responsibility. Now, the executive committee member in this case has indicated that whereas he is responsible to the governor on execution and running of the department, that in fact the delay was not on his side. The delay was on approval of a cabinet paper. Presumably, a cabinet is the county executive committee approval. And therefore, the delay was by the county executive committee granting an approval for the supply. And therefore, the CECM member has provided evidence that was responsible enough. But others were not responsible, and they should be blamed for the delay. So Member Fuelima, according to these records, the CECM member indicates that he got approval on 26th of July, and that on the same day a PO was processed, a purchase order, and that supplies were given sometimes in from 26th to 12th of July, so within approximately 10 days or thereabout, then the commodities, the drugs and commodities were supplied to the hospital. So between 26th, when the approval is given, and 12th of August, reasonably, there's no delay. So there seems a delay from when the budget is approved on 30th of June, or from the last quarter of the last financial year, which is, you should be planning for the next quarter, then it was obvious that in the first quarter of this financial year, there will be need for drugs and commodities in hospitals. So what the ECM is saying is that all those plans had been given, presumably, the last quarter of the last financial year. So the delay is not on the CCM member. So who is responsible? I will refer you. Who is responsible? Leader of Majority. Who is the chairperson of the County Executive Committee? Where the CECM member is a member of that County Executive Committee. Now, this is matter that is touching on, in other words, the CECM member has attributed the delay and failure and lack of drugs to its appointing authority or the committee that it sits. That's what he's saying. He's not to blame. And as proven that when the paper was approved from the committee where he sits, reasonably, the commodities were supplied. Are we together on that? Now, what is important now is for us to inquire into as to whether, firstly, at what time was that county executive committee chaired by the governor and deputized by the deputy governor, whether it received and when it received that request. Point number 2, it is important for us to know, because this is a matter that has been lingering and has been malignant in our hospital sector and healthcare sector. Is there a memorandum or an agreement or a contract for supply of medical and non-medical, which are pharmaceuticals and non-pharmaceuticals, to our hospitals? Because there must be an engagement between the county government of Makueni and another, so that irrespective of disbursement of funds, then Kenya Medical Supplies Agency, or meant as Honorable Moki has indicated, as a responsibility and as an engagement with us. For example, Kenya Power Lighting Company, I've never heard of Kenya Power Lighting Company disconnecting electricity in public institutions. Reasonably, because they know that obviously the county government has a budget for that and that will be cut out. Unless then the county government is in debt. So there's no reason as to why we should lack pharmaceuticals and non-pharmaceuticals because of a beginning of financial year. Just to state that salaries were paid and they were borrowed, and there is a good agreement between the county government of Makueni, in this case, county executive, and Kenya Commercial Bank, so that the members and the staff from the governor to the lowest paid officer will never lack their salaries when it falls end of a month. Similarly, there is a robust and a proper arrangement between the County Assembly of Makueni and the Cooperative Bank of Makueni, where I sit as the chairperson of the Assembly Service Board, and we have assigned agreement and a memorandum on how we shall work with or without resources so that the bank may facilitate salaries without interest, and so is KCB Bank. And this KCB is gaining profit by collecting revenue from Makueni County. It also extends an arm to facilitate salaries even when we do not have disbursement. Now, that is one part of the same government. Now, when it comes to the citizens, where the nurses should be working for the patients, then the nurse has a salary, the doctor has arrangements and a memorandum and agreement on how that doctor will be paid salary without delay. But when they are in hospitals, the drugs are not available. Now, the same cabinet has made sure, and the same county assembly board has made sure that their officers are taken care of. But the people we represent are not taken care of. The people who elected the governor and the executive are not taken care of in terms of their health. So, a matter of determination going back is that is there an instrument of agreement between us to ensure that they are smooth and running programs for the supply. Two of it is their annual plan. At the closure of the financial year, then there should be an annual plan indicating that beginning from 1st of July, this should happen so that there is no lapse. That then drugs should be requested even the year before, or arrangements were made so that before the start of July, commodities for the first quarter are supplied, because the assembly will give evidence that is an approved amount of budget in our budget provisions for medical supplies. Chairperson for Health. So, what we require from you, Chair, because this statement answer is so simple, but one of its kind ever since I became a speaker, that a member of the executive committee has said that the delay was in the committee where they sit, chaired by the governor. And therefore, I'm afraid we may not leave it as such. You know what that means. It means then that the failure has been occasioned by the county executive committee. So your problems are not to be blamed on the Department on Health, but the entire cabinet. So it is as big as that. However, it is small. Two of it is give a detailed schedule of expected medical supplies the next 6 months. And before then, if no, what is the cause of the lack of communication so that the residents know how to prepare when seeking treatment? The answer is the department was aware of the shortages. You see, this answer, the author is not careful to Article 34. And Article 34, is it 34 or 35, where every person, every citizen has a right to health. It's Article what? Should be 34, 35 for thereabout. 43. Yes, thank you very much, Honorable Moki. That's what I was asking, whether you're still in the... Every person has a right to the highest... And remember, in this article on economic and social rights, in law, the section that comes first is superior to any other. So, in section 43, there are so many rights. But the first right is superior to the other. Every person has a right to the highest attainable standards of health, which includes the right to health and care of services, including reproductive health care. Now, how then do you indicate the department is aware that there were no drugs? So I knew I could not do anything, but notwithstanding Article 43, the cabinet is to blame. That short sentence, it is in itself confirmation of violation of Article 43. And B is give detailed schedule of expected medical supplies for the next 6 months. And the answer is the essential medicine and medical supplies are procured on quarterly basis. For the first quarter, the deliveries started and were expected to continue for 2 weeks after August. However, supplies schedules are disputed when there is delayed disbursement of funds of the national. The answer is to another question. The question is not answered. The member is asking for a schedule for the next 6 months. In other words, if this schedule for 6 months is not here, then there is no schedule, there is no annual schedule. Meaning, we have a budget of figure X. Then it should tell you that on quarterly basis is X divided by 4. And that is scientific, must have been arrived based on the last financial year on how drugs were consumed. And then therefore, if you cannot tabulate 12 months on quarterly basis, then you cannot tabulate on monthly basis. It therefore follows you may not be able to tabulate on a weekly basis and on a daily basis, and therefore accounting daily consumption, hourly consumption, and therefore weekly, monthly, and quarterly, it is not possible. And therefore it's going to be an imbus planning based on whether we have drugs or no drugs, according to this answer. Then the last one, how was the department dealing with the poor health practitioners to patient interaction in the county health facility? And the response is the department established customer care desk hospitals to assist patient relations. Then the staff were also trained on the customer care to improve quality health care. Grievance resolution mechanism had also been established through suggestion box and grievances mechanisms and register setup. Now, if this is the case, and is a matter that has been discussed in this house, we cannot assume this is an answer because another member is raising that matter after it was raised in Makwen Referral Hospital. Then, Chairperson, there is a need to provide for an evidence of a training of this staff on customer care, where it took place. Was it virtual? Was it a document? And where is that signed document were officers? So that then the members of the county assembly, in a subsequent oversight, you will visit your dispensary with a questionnaire and ask, we wish to know whether you have ever been invited for a training on customer care. Because as it has been said before, the customer care relations has affected the healthcare behavior in our county, where citizens do not want to approach the hospitals and they feel that the hospitals are not responsive because that the department has not facilitated software skills to make the customer clinician relationship social and a little bit friendly for them then to interact. So, Chairperson, the answers are short, and I like what you said. You said, Mr. Speaker, may I first read the questions as asked and then proceed to read the answers as provided. So at the inception, I heard you. You conveyed. You did not own. I heard you. Then therefore, for you to own, we will require a detailed response on these issues, and particularly on a substantive response on the question number 1, where the county executive committee failed to do so. And on this particular one, let the ECM produce evidence of the document that were raised to that county executive committee member, and as a county secretary, therefore, who is the secretary to confirm to this assertion. Remember, section 39, no, not 39, I think it's 40 what? The county secretary, the secretary to the...
Guidance on how we can approach the matter. Honorable Speaker, we thank you because you've given your guidance on how we're going to deal with the matter. Because we, at some point, the member for Kako was feeling the deputy leader of majority should face the whole question and face the governor and ask the governor why the delay was occasioned in a cabinet where he's the chair. So, Honorable Speaker, there was a lot of debate in the committee on that response, question 1. So we were asking, do we take this to the leadership of the House we ask the leader of majority to ask the governor why the delay was occasioned by the cabinet, or where do we take the blame? So, Honorable Speaker, we will pursue the matter and come back to this House with a response. Thank you, Honorable Speaker.
Honorable members, I've indicated to you Section 39 that the County Executive Committee member is responsible. So, from morning to the evening, if there is a delay by an hour, then the member should bother to know from the governor or from the cabinet. Health is an urgent and is an emergency. Not once or twice we have heard of the radio, the governor insisting the need for regular and predictable supply of commodities. So I hear you, and that is why we want to determine that if this executive committee member has indicated that the cabinet is responsible for the delay, then and aware that there's supposed to be a procurement plan. In fact, there's supposed to be after the closure of financial year, when the budget is approved, immediately what you do is to, according to the Public Procurement and Asset Disposal Act, is approval of a procurement plan for every department. It is based on the procurement plan that then papers are derived. Procurement plan, one item, is construction of hospitals, supply of commodities, there is employment of doctors and all that. Then whereas one will be requesting for employment of the nurses to the Public Service Board from the cabinet, which may not be an emergency and urgency under Article 43, then it follows that in the absence of that procurement plan, that's why I asked whether there is an annual plan, which is an annual procurement plan, you can't do it. And if it was not read in the previous financial year, the closure, or now to begin the next financial year, it then explains why the executive committee member cannot give a schedule for 6 months. Because if the executive committee member had the annual procurement plan for pharmaceuticals and non-pharmaceuticals, then all he needed to do was to plug the 6-month schedule. In fact, would have given you, instead of 6, I give you 12 months, the whole year. So it's a demonstration that there is lack of it. And therefore, we will not sit here again and never again to discuss delayed commodities in the hospitals, which is predictable because we knew how much they take every June. You require more Hamoxil, Honorable Mbalu, around the June than in August and September, October. And therefore, the uniqueness of supply has been known from 2013. So that should not be a case. It's not about rainfall, which is not predictable. The tendencies of supplies and the nature of the sicknesses is known. And you know that you require more amoxicillin and antibiotics in the upper islands than in the lowlands, because also some diseases and prevalences is on some areas than others. So, honorable members, we are not going to tolerate this any further. The only matter that we will ever discuss here is that the allocation for that financial year or for the first quarter was not sufficient because the consumption was high, because there was an outbreak, or more patients were visiting the hospital, or maybe we have a spillover because less patients were visiting the hospital because of CHVs, and therefore there is a prevention aspect. We must get to that point, but we cannot continue to be flagged on newspapers and TVs, whereas we are not able to predict drug supply for a county government in our dispensaries for 12 months. It's unacceptable. So Chairperson, we are dealing with this matter, and they refer to it as perpendicularly. It is not diagonal, it is not parallel, there is no convergence. It is perpendicularly. We would not tolerate it anymore. It's an embarrassment that people McQueen every other time they have to cause a delay. If there is a delay, must be to another factor. However, you would rather delay requisitions for supplies in the county assembly, and then members are explaining that the little money that we received for the assembly and staff allowances, we prioritize to pay medicines. Who would not bear with that? We will bear, because even when they do not have the medicine and you paid your salary, you will still get that money to help them to buy the medicines from the private clinics. So this must be crushed. Chair and your team. Honorable Mwoki, I think now we are better equipped because you are on the oversight of the Committee on Health. You are not a member.
Correct, Mr. Speaker. The Speaker, I took the decision to leave the Committee on Health so that I can be of help in this assembly, Mr. Speaker, because I am a health professional with a lot of experience in drugs, Mr. Speaker. When I left college, Mr. Speaker, I worked for 2 years in Murang'a district, and I became the
When was that? When was that?
That was 1987, Mr. Speaker. By the year 1988, I was in charge of pharmaceuticals in Murang'a district, Mr. Speaker. And I worked in that position for 3 years. Then I was transferred to and seconded to NGO, Kenya Society for the Blind, under the Royal Society for the Blind in Britain, Mr. Speaker, where I was in charge of the National Eye Drops Production Unit, where I worked for 6 months, supplying drugs to Makueni District Hospital, Kenyatta National Hospital, and all the other district hospitals in the country, Mr. Speaker, working with ophthalmologists and clinical officers, ophthalmologists, Mr. Speaker. Some of the members who are here, Mr. Speaker, I am sure they must have be treated for trachoma using drugs that I prepared when I was producing eye drops at the Kenya National Eye Drops Production Unit, Mr. Speaker. There were so many vehicles here named Blue Peter. They had a level Blue Peter, Kenya Society for the Blind, Mr. Speaker. So, in the matters of health, Mr. Speaker, I think I have a lot of experience and a lot of I can contribute a lot in trying to make things straight. Thank you, Mr. Speaker.
Honorable members, without attracting a lot of points of order and questions, may I plead that we proceed? By the request of the statement, I think that matter is properly addressed. Fair enough.
I think the issue is put at rest. Only one statement that it's good to remember. From 2013 coming this way, Makueni count was all over in the papers as the count on top of the agenda on matters of health. We cannot allow that glory to go down. Thank you, Mr. Speaker.
Is that leader of the minority? Fair enough. Chairperson, how much time do you require to respond to that issue? Remember, we are towards end of August, so the first quarter is ending, and it has been indicated that the second quarter is not very sure because there is no work plan. And the second quarter should be planned in the first quarter to ensure that there is no irregularity in supplies.
Honorable Speaker, we will do this and endeavor to bring the response in 7 days.
Fair enough. And Honorable Chair, on the first instance when you will present that response, if it is not satisfactory, we will canvass this on the floor of the House. So we will not give you another opportunity.
Well guided.
And that has two meanings. One, when a matter is referred to general oversight, either it is too wide that you require members to ventilate, or the committee is unable. So we will determine that time which will be applicable.
Okay, thank you, Honorable Speaker. I know from where we sit, the Committee on Health Services has never been incapable of achieving anything. And you know, before this House, we have dealt with very pertinent issues and we have succeeded. So it will not be on the part of the committee. It may come from elsewhere, not the committee level. Thank you, Honorable Speaker.
While at that, the assembly dealt with another matter related to health care workers. And there were recommendations ranging from 30 days, 60 days, 90 days. Have you bothered to find out the status of implementation? Because I think it's another looming issue. I spotted something on social media on the same.
Yes, and some of this was captured in the implementation status report that we brought in the House last week. I think last week, but one or last week. And there are other pending issues that we recommended that we will pursue also as a committee. So that was part of the recommendations that were in that status. Some have been implemented, others are partially ongoing, and there are others that are not fully implemented and we are still following as a committee.
Fair enough, endeavor to do so. Next order.
Order number 8, motion. The report of the Committee on Devolution, Public Participation, County Administration and Special Programs on the operations of the Makueni County Public Service Board.
Honorable members, before we go to the next order, member for Kikumbuli North sought Kikumbuli South, Honorable Kalunda, sought from the speaker to know or get directions. Unfortunately, I have had the answer for the directions, but you have not been around for some time. So now that you are available, I have to take advantage because I am not sure when to see you again. Because lastly, under statements, you are not present and you sought the communication. You sought to know that this assembly resolved to approve a chief officer in the Department of Health Services, and that according to you, that officer, that resolution of the county assembly has not been implemented. Now, I have the following directions to make regarding your point of order. That are where standing orders provide that within 60 days, after the resolution of a county assembly, the respective committee shall propose to file before this assembly and report on the status of implementation of that recommendation, in which this case was a report by the Committee on Health approved by the House. Therefore, Chairperson Committee on Health Services, Chairperson Committee on Health Services on the matter of Honorable Kalunda, understanding orders, you will proceed, inquire into from the person responsible for the implementation of that resolution of the House on approval of a chief officer for the Department of Health on the status of implementation of that resolution and report back to the House. How much time do you require, Chairperson?
Honorable Speaker, we will bring the response in 7 days because I think this is a matter that also the county secretary must be aware of what has happened and he needs to respond as fast as possible because we will not be requiring details of any other thing because the CEO was approved and we only require why they have not been sworn in to serve in that position. So in 7 days, we will bring a response.
Fair enough. Honorable Kalunda, I just sought to know the status of implementation of the resolution of the House on the appointment and approval of the Chief Officer for Health Services.
Thank you, Honorable Speaker. Honorable Speaker, I want to confirm that last week I was not available. I had lost one of my cousins and we were making plans to bury him, which we have partly been able to make those plans because the hospital bill was huge and he is lying at Kenyatta National Hospital, but we hope to make it happen this week. Honorable Speaker, it's rare for me to miss the assembly sittings. It's very rare for me. and everybody knows that. It's very rare. But I was also inquiring, as I was at Kibwezi, I was still inquiring on the progress of the same, which seems to be very short. The response is very short from the speaker. And my question is whether the Committee on Health has any role, because it is the governor who is supposed to be appointing that member of the executive, Honorable Speaker, because the committee will only say, because I saw their progress report, the implementation status of the last session, Honorable Speaker, and it was very clear that they considered and approved a chief officer in charge of HR and administration. That is where the role stops. They can only report that, Honorable Speaker. When you look at 204, their limitation is up to just that, Honorable Speaker. They cannot tell us whether he was appointed or not. That's why the Committee on Implementation can have a bigger role than the Committee on Health, because the Committee on Implementation will look at the implementation status and the extent to which that implementation has happened, Honorable Speaker. So when now you throw the ball to the Committee on Health, Honorable Speaker, it begs the question whether they will be able to prosecute this matter, which is very dire, because if the chief officer is not appointed as recommended as per the resolutions of this county assembly, Honorable Speaker, it means the people of Makueni are not getting the service they deserve, Honorable Speaker.
Now you have gone further.
We
just want to limit ourselves to practical things. And you have questioned as to whether Committee on Health or implementation.
Yes.
Now, whether the people are lacking the services or not, unless the Committee on Implementation or Health now provides evidence. Because you did not provide evidence, you indicated that you are aware. I did not bother to ask you to provide evidence because matters of health are sensitive. That is why we want a committee to tell us what is the actual status as of today. That's a point.
I get you.
So
maybe we're not communicating, Honorable Speaker. My question was not to debate. My question was just to get some clear information from the Speaker, who is the head of this assembly.
Yes.
And the question was very simple. It has never happened. If
you could repeat the question.
If we bypass, Honorable Speaker.
You could repeat the question.
Which question?
What was your question? Because it's like we are not understanding the question.
Yeah, the question is, I even said, when I stood on the point of order, my statement was very simple, that we will set a bad precedence for future regimes. If the assembly can resolute that we pass a name as a chief officer, then the governor doesn't send a memorandum to reject that resolution, Honorable Speaker. It doesn't work. And we are just setting things
I hear you.
Clear.
I think
Speaker.
Your question is very clear. Now that I've given you some benefit of doubt for a committee to inquire, if we drop that route, I'll ask you, would you provide evidence as basis of that inquiry?
Yes, I can provide.
You will table?
I can table. He has not been appointed.
So when
he was never appointed.
No, when Honorable Galunda, you raised an issue and sought the intervention of the chair.
Yes.
To advise that you are aware that a resolution of the House has not been implemented. And implementation is appointment. I have given you the advice you sought.
Thank you, Honorable Speaker.
And the Assembly cannot continue on a hearsay. That is why Standing Order 204, and it reads, Mheshimiwa, because you sought my intervention, within 60 days of resolution of account assembly or adoption of a report of a select committee, including petitions. In this case, the report which was presented on approval of a chief officer for for health services by this house. So that's the resolution. The relevant county executive committee member under whose portfolio implementation of the resolution falls shall provide a report to the relevant committee of the county assembly in accordance with section 39(2) of the County Governments Act.